You couldn't make this up, could you? I mean, you really couldn't make this up. Calocane was a clear and present danger. He was hearing voices all the time. He was breaking into flats because he thought the voices were coming from the flat. At one stage, he thought his mother was being raped in a flat and he broke in. He was terrifying his neighbours. He was terrifying strangers. He was sectioned, allowed out, sectioned, allowed out, sectioned, allowed out. And then he went on to kill. I mean, it's indescribably incompetent.
And the family have said of the victims, the people in charge have got blood on their hands. He should have been in custody, or
he should have been in a secure psychiatric unit.
He should, because he was sectioned 4 times. There was a pattern of violent behaviour which was getting worse. He wasn't taking his medication, and that was happening repeatedly. And so he needed to be in a secure institution where he could have had his treatment injected into him.
And he was lying to his doctors. He was saying when he was banged up, basically, because he didn't like that.
But that's almost understandable. It's something that happens time and time again. I think one of the things that was highlighted, and Caroline, I don't know how you feel about this, it's something that carers and family members of someone with a mental illness have long complained about. Calocane said he didn't want the rest of his family to know anything about his diagnosis. As things stand, that's their right. But the family didn't hear the word schizophrenia even mentioned until after these dreadful, dreadful killings.
Yeah, and it's completely understandable that both, the families of the victims, are feeling distraught, and, were obviously distraught before, but this just piles it on for them because of what they can see as the missed opportunities. For someone like this, of course, there's a whole number of people that might be involved, but some of the people who should be involved, Tricia, as you say, is listening to those who are closest to him, who see him in different environments to that which psychiatrists and the police see, and they are listened to. And I think that's such an important part of how we work with these individuals with extreme mental health conditions, because it's that piecing together of the fuller picture that can enable the services to do the best they can. But there's no easy answer for these individuals.
No,
this is a service area, to be honest, that doesn't get a huge amount of talking about. Quite rightly, we hear a lot about issues around anxiety, depression, and that's really important that that's being discussed more openly. But we don't really spend enough time talking about this particular group of patients and their needs, Karen, and how to deal with them.
But in this particular case, unusually, a doctor warned in one of the reports, Calocane could kill. Yeah. And that's unusual.
Sharon, it is really unusual for somebody, a doctor, actually to write that down in a report. I was really shocked to hear that. Were you?
A couple of things struck me. First of all, I thought that doctor was very perceptive in predicting the future, because I would argue that up until that point, his risk profile was worrying, but it wasn't very concerning. So another way of putting that is that I've worked in criminal courts as a psychiatrist, and I don't want to alarm your viewers, but I would see dozens of patients every week that would have that low-level offending, low-level violence, and the vast, vast majority won't go on to do something as heinous as murder. So that's the first thing. And the second thing that I thought is the same as I think everybody else is thinking is, if that doctor genuinely thought that, why did they not act on it? Why was he discharged within a couple of weeks?
How difficult is it to assess someone like him when actually they're clever and they're quite good at lying? As I was going to say earlier, he didn't like being locked up, obviously, so he lied to his doctors, and he said that he wasn't hearing the voices anymore. He was. We know that because he told someone else when they let him out. But he lied, and lied convincingly, so they thought he was getting better.
So I think there's a couple of hurdles here. First of all, as you say, whether a patient is actually engaging, whether they've got insight, whether they're letting the medical staff know about their innermost delusions and intentions. So that's really difficult to do if somebody's, not playing ball. So that's one issue. But another issue is that you can get somebody well at the point of discharge. And that's not the problem. The problem is when they're in the community weeks, months later, when they start taking
and the follow-up.
So they could be relatively safe at the point of discharge, but later on they become dangerous.
Sharon, I know they're going to be looking, the Labour government is going to be revisiting, hopefully, the Mental Health Act, which needs an absolute overhaul. But at the moment, the way the mental health services are, they're on their knees. You have to become more and more and more ill. We've had several incidents, many, many thousands. And of course, we've got the Lampard inquiry coming up, looking into 2,000 deaths, from 2000 to 2023. But people go in and say, listen, when they do say, I am hearing voices, I am ill, you're not ill enough. Come back when you're absolutely you know, too far gone, and then you get these situations where people are acting out or taking it a step further purely to get a bed within a mental health facility.
And the number of beds have gone down, Trish.
Yeah.
Inpatient beds have gone down. And on the one hand, understandably, there's been big debates about, you know, actually why are people in some of these inpatient units, not necessarily with the conditions that this man has, but why are they there? There should be more community, and there's an argument for that. But the truth is, none of this is cheap.
No.
Yeah.
And it can't be fragmented. When someone comes out of an inpatient unit and goes into... we were talking earlier, there is a framework for actually community treatment. There are orders that can be used to ensure that the person does turn up and has to turn up and have conversations with their mental health support worker. But actually, it's still fragmented and it's under-resourced. It's under-resourced.
Could we ask you this question? I mean, you work with these people, as you say, and you've seen some very alarming cases presented to you that you've had to treat. What's the takeaway from this report for you as a professional? What would you have done differently?
So I think the problem isn't that we don't have the safeguards. The safeguards exist. So Caroline mentioned there's community treatment orders, which is like a contract with the patient to take their medication. We have assertive outreach teams that will literally go to the patient's house and supervise them on a regular basis. So the problem isn't the systems don't exist. The problem is there's not enough resources.
Yeah.
So all of these teams are so overwhelmed and overburdened that they've got this pressure to try and discharge people as soon as possible because the waiting list is...
So does that mean that someone like you, I'm not saying you personally, but someone like you doing the job you're doing, is knowingly, because of that pressure, discharging the patient like Calocane, knowing that actually they're not quite right?
You don't... But here's the thing, you don't know. I mean, I'm biased because my late sister had paranoid schizophrenia, and we do have to say that you're more likely to kill yourself, sadly, and that's a failing of the system. But the fact is, and Caroline, you absolutely said it, the resources in the mental health system have been chipped away and chipped away. CAMS for teenagers, you know, getting in early intervention. You try and find a mental health intervention for a young person before they become, you know, taken over by the system. Hen's teeth, isn't it?
And for these particular individuals, you know, obviously the Labour government said they want to put more people into schools to support young people, and that's really important. But for these particular individuals, there is quite a complicated set of treatments and support that is required. That has to be personalised to those individuals, may involve years of inpatient, outpatient, community-based treatments as well. And it's going to need a lot more thinking about getting that right. I think we have the staff who are really committed in this area.
Yeah.
I think we have the framework. It's about the resources and reducing the piecemeal way in which some of the different services, like the police, operate as well with our mental health
But this has been
workers.
a Cinderella part of the NHS for years.
Oh, yeah.
Because
Totally.
I was just remembering... Do you remember when Jonathan Zito was stabbed to death on a London Underground station by a paranoid schizophrenic who'd been in and out of the system over 5 years? That was 30 years ago. Stabbed to death,
It's
failed
still,
by the system, and I
going on.
don't think much has changed.
Well, and the truth is that, you know, in the last 18 months, with everything that's been happening, again, as in previous decades, it's the acute sector, the A&E, the waits there. You know, the push is then to prioritise getting people through the A&E. And at some point, you've got to think about, well, you know, where does that leave these services? And often it's not in the place they need to be in terms of the importance they have to our health and well-being.
Can I just ask you a sort of clinical question? When you're treating somebody who hears voices, which they are convinced are real. They know they're in their head, but they think they're coming from real entities, real people. Is there any point in their treatment when you're able to persuade them through medication or through some kind of counselling that actually they're not real? Or do they constantly think that they're real?
So my answer to that, Richard, would be it very much depends on the patient. So firstly, you can't detain somebody unless under the Mental Health Act unless there's a degree of risk. So an individual can be hearing voices, but if they're not command hallucinations telling them to hurt themselves or other people, then you can't force them.
Sometimes the voices are nice and encouraging. They're not always...
Yeah.
And then part of the treatment, as well as the medication, as well as the antipsychotics, is psychotherapy. So the psychologist on the team will speak to the individual, and some individuals, once they've taken the medications and the voices go, they get insight. Other individuals, through talking through logically whether the voices exist or not, they eventually gain insight gradually. Unfortunately, there's some individuals who never gain insight, so it's a constant battle of relapsing and remitting medication, getting off medication.
Just on a human level, what would have been the reaction the morning after these terrible killings amongst the people who'd been treating him and who discharged him? How would they have felt?
I think they'd be absolutely shocked. They'd be questioning themselves, did they make the wrong call? I alluded to this before, but I do think Calocane's risk profile wasn't actually that alarming before he did what he did. But I still think they'll be questioning themselves, absolutely.
Except that doctor did argue that he was a potential killer. So wasn't his risk profile more severe than perhaps normal? Because that is an unusual thing, isn't it, for a doctor to say?
It's a very unusual thing to say, but I don't know how the doctor knew that, because, as I say, there's so many other people. There's
but he was right.
Thousands of
he did know.
But he did,
He was right.
It is a very, very complicated issue. But, as you say, it's got to be about resources and joined-up services, including the police.
Well, look, the National Director for Mental Health at NHS England, Claire Murdoch, has said this. CQC have identified unacceptable failings in the care and treatment provided to Valdo Calocane. Nationally, the NHS has already started work to enact all of CQC's recommendations, with every provider of mental health services reviewing the care that people with serious mental illnesses are getting. It goes on to say that they've also provided further guidance which instructs providers not to discharge people if they don't attend appointments, and reiterates the importance of sharing risk assessments with the partners and the patients' families, which, of course, did not happen in this particular case.
And if you've been affected by any of the issues that we've been discussing, you can find advice and support at itv.com/helplines.
OK, and of course the victims are, today as we speak, the people suffering because their families were the victims. And we're going to be speaking to Emma Webber, the mother of one of them, just after 8 o'clock. A very bleak morning for all of those families, having seen that panorama report last night and, of course, having seen the results of that report this morning. OK, we'll come back to that. Thank you very much indeed for your time this morning. That was really interesting.